Hey everybody, good morning. Welcome to today's Meow Yoga. Our focus for today's class is the neck. I have discovered in myself and many patients over the years that the neck can be a real pain in the neck. It seems like all of my stress, all of life's events land right here, and it requires an active intervention to get all of that muscle tension out of there. It seems to not go away on its own very much. So what's happening here is that it's basically like your neck went to the gym and got really sore. You know how if you lift weights too hard or something, you'll have that buildup of lactic acid in your muscles, and then your muscles really hurt. The same thing happens to your neck. If you're under stress, you're kind of subconsciously lifting your shoulders up or and then pretty soon it's as if your neck muscles have just worked out too hard and they hurt. What happens is it's like it flips a switch in the midbrain right back here between where your brain joins your spinal cord, and it just triggers that whole cascade of events that result in migraine. So when we start to feel this neck pain coming on, we've got to intervene so that that doesn't happen, because those can be some of the hardest ones to relieve. Now, I'm sure many of you have had good benefit from things like chiropractic, massage, physical therapy, acupuncture, dry needling, and I love those things too. I just feel like there are a couple of downsides to that. Number one, it leaves me dependent on the chiropractor to make me feel better, which, I mean, I'd rather be empowered with the information to fix this problem myself. I'm so glad that they are there and help people in that way. But I do feel like I would rather know how to do this on my own, how to fix this problem when I need to. So I think that's one advantage. And the other, just, kind of logic, like the chiropractor's not there when it's 2 a.m. and you're in pain, or you've been traveling, you're in another country, and you can't access those resources. So that is part of the reason that I've put a lot of time and energy into developing a neck flow. So this practice is not a well-balanced yoga practice at all today. We are focusing mostly on the neck and shoulders and upper back. All this stuff is connected here. And you can do this practice even if you're having a headache right now. We're not going to do any inversions. There's only one optional thing. And we're going to start with a little bit of a body scan at the beginning, and then we'll do that again at the end to really bring your focus on the changes that you're creating in your body. The whole purpose of yoga is to use it as a tool to reduce your physical symptoms and improve your quality of life. So you need to develop your capacity to tune in, listen to your body at the beginning, do some movements, listen to your body at the end so that you understand exactly what worked for your body and what didn't. And you can say, okay, next time I'm feeling like this, like you are at the beginning, I know exactly the movements I need to do to make myself feel the way I did at the end. And that's where the empowerment is. So you are learning new tools to help you literally reduce pain and improve the quality of your life. All right, so that's our goal for today. The only thing you need for today is some kind of a cushion to sit on for the meditations, which will be fairly brief, and you need your journal for the end. We will do our usual W component of our meow, which is words. All right, so let's get started. All right. Come onto your meditation cushion or whatever you use, just enough so that your hips are above the level of your knees. It's much easier to keep your spine tall, and it's more comfortable. I like to always kind of move this flesh out from under the sit bones, makes it much more stable and grounded. So we will begin with a quick body scan. Close your eyes and bring your attention into your left foot, left calf, knee, thigh, just observing like the neutral eye of a camera, no processing, no emotions, no thinking. Left hip, pelvis, right hip, right thigh. Noticing any areas of discomfort, pinching, holding muscle tension. Right knee, right calf, right foot, base of the spine, middle spine, upper spine, both shoulders, both upper arms, both elbows, both forearms, both hands, back of the head, top of the head, forehead, eyes, nostrils, lips, tongue, jaw, neck. And just take a moment to go over in your head what you found in your body today. Make a mental note. Okay. All right, we will begin today in child's pose. So I'll show two options for you here. The optimal way to do this, if it's okay in your body, is to start in tabletop. Spread your knees out a little bit wider and lower your hips over your feet, and then bring your forehead down to the mat. Now, if that is not going to work for your body, bring a cushion or support of some sort under your hips and try from here. That does take the pressure off the hips and knees. It's a little bit harder to do what we're going to do from that position. So pick whatever is good for you. And then what I'd like you to do is rock back and forth across your forehead, but initiate the movement from your knees. So press down with your right knee. And see how even if you keep your head and neck completely passive, it rolls your forehead across your mat. Do the same thing on the other side. Push down with your left knee. Keep your head and neck completely passive. And then slowly roll your forehead back and forth across your mat. Now, options here. You can, if it's okay in your body, bring your knees closer together and put your hands behind you. If you want to experiment with that and see if that feels better to you. But again, the one thing that you want to keep constant, no matter what variation of this pose you're choosing, is keep your head and neck completely effortless, no muscle contraction at all, and initiate the movement by pressing your knee into your mat. This actually feels amazing when you've got a headache. We'll take a minute here to explore this in your body and find the thing that makes you say, yeah, that's it. That's what my body wants. All right, release the movement. Release the movement and slowly move up. And then come into a seated position. We are going to do a seated twist, which I prefer to do without a cushion, but if your body likes it better with the cushion, please come back onto your cushion. Inhale your arms up. Exhale, release. Twist to the side. Now, twisting always needs to happen from the place of a straight spine. You don't want to twist from here, nothing like that. You want the sensation that there's a cord on top of your head, lengthening your spine up towards the ceiling as much as possible. So when we inhale, we lengthen up as if we were a merry-go-round pole and our body is just spinning around that pole. So inhale, lengthen, exhale, twist. And I just got like a little mini chiropractic adjustment. Free chiro. All right, inhale, lengthen, exhale, twist. There's effort here in your arms, kind of torquing your body around. Inhale, lengthen, exhale, twist. And as you get to the limits of the amount your body wants to twist, you'll notice that you only move about 1 millimeter or so, which is fine. Inhale, lengthen, exhale, twist. And release. Come back to center, hands on both knees. Now, I'd like you to move your thoracic spine, which is the part between your belly button and your neck, back towards the wall behind you. Hollow out your shoulders, meaning kind of go like this. Move everything in your upper body as far towards the wall behind you as you can. Let your chin tuck to your chest. Really kind of almost pulling the shoulders out of your sockets because you're holding onto your knees really strongly and pulling backwards. So those shoulders are getting a good stretch, kind of coming out of their sockets a little bit. You know what I mean? And then reverse it. Bring your chest towards the wall in front of you. Bring your elbows behind. Look up just a little, but you don't want to be cranking your neck back like this. More of a lift. Let me show you from the side. Here's my chest. It's more this. Yeah, do you see what I'm saying? Lifting from your upper chest up towards the ceiling. That's what we're shooting for. You're literally contracting those muscles in your upper back. Whoops, don't need that. Forgot about my phone. All right. So one more time. Bring your sternum towards the wall in front of you. Lift your chest up. Bring your elbows back towards each other. So there's work going on in your upper back. You are literally contracting those muscles hard. Really, really bringing your elbows back towards each other. So you'll see what we're doing here, right? This way we've got the stretch on those muscles. This way we've got the contraction. And what is that? That's proprioceptive neural facilitation. Okay. Inhale, bring your arms up. Twist to the left. Let your arms drop. Lengthen up like your spine is a merry-go-round pole. And then twist on your exhale. Inhale, lengthen. Exhale, twist. Inhale, lengthen. Exhale, twist. Now spend a few breaths here playing with this in your own body. Most important thing is to make sure you are twisting around a tall spine, not compressed down, not leaning to the side. Straighten up as tall as you can and twist from there. This is essentially wringing out the discs in your thoracic spine. Those discs don't have a good supply of blood to come and clean them out. Fluid comes in and out by passive diffusion. And that's what you are doing here. That is why MRI studies show that people who do yoga have healthier discs. And release. One more time for our seated cat-cow. Thoracic spine towards the wall behind you. Tuck your chin to your chest. Move your sternum towards the wall in front of you. Lift your chest up towards the ceiling. Lift, 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 and bring your elbows towards each other. Lots of work in your upper back. When you bring in the blood flow, you are washing out those muscles, getting all of the lactic acid out. And release. Now, I'd like you to bring your hands maybe a foot or so behind you, sort of lean backwards and scrunch your shoulders up to your ear, like really, really compress everything like this, okay? And then push down, stretch them out, bring your chin to your chest. So scrunch up, 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 like really activate those muscles. I need my hands to be wider. There we go. Like you're really, really bringing your shoulders as close to your ears as you can get them. And then push up. Bring your chin towards your chest. Scrunch your shoulders back up towards your ears. You're almost really contracting here, contracting those muscles. You're trying so hard to get your shoulders up to the top of your ears and then push them out. A couple more of these with your own breath. All right. And then come into a seated position with your left leg straight and your right leg bent. Again, kind of move your flesh out from under those sit bones. Inhale your arms up tall. Exhale, come to the right. Now, for this one, we're not trying to lever ourselves around. Really, what we're doing is bringing our chest over the knee, okay? So we're not doing a massive twist like we were before, just bringing the chest over the knee, but your arms are to the side. Your right hand goes out like literally a foot or a foot and a half behind your body, because what we're gonna do is lower this left shoulder down and tilt your head to the right. Feel that? Good morning, neck. Whew. So the two key things here are shoulder down, ear to right ear to right shoulder. So left shoulder down, right ear to right shoulder. And then we're going to bring in some of that cat-cow that we were doing a minute ago. So start to tuck your chin to your chest, move slowly here. There's a lot going on in the neck. And start to move your thoracic spine back, just like you were a minute ago. Ooh, that triggers all kinds of stuff in the neck. This is really good for pain in those muscles along the spine in the back. And then gradually, slowly listen to your body, move slow. Don't do anything that feels awful. Start to come to our cow, right? We're doing the seated cat-cow like we did a minute ago. Bring your head up towards the ceiling. This is really good for all those muscles in the front of the neck. So explore this on your own for the next minute or two. Important features: keep your right ear tilted to your right shoulder. And you are basically doing that seated cat-cow movement we did a minute ago.
And if there is one area that needs a little extra love, feel free to hold it. You do not have to be moving the entire time. Listen to your body and give it what it seems to need.
All right, release, meet back in center. And then we will take a little bit of a forward fold over your left knee. So reach for the outside of your left foot. Feel free to bend your knee if that's too much on the hamstrings. It's important here to keep this right hip grounded down towards your mat. All right. Sometimes it also helps to push into the ground with your left hand to help keep that right hip on the floor, because we're actually stretching out the lower back here. That is the purpose of this stretch. A little bit of hamstring stretch, totally fine. It's a forward fold. It's good for anxiety, which is usually going on when you're having neck pain. But we are really trying to stretch out that right lower torso. It's a hard part of your body to stretch. And you'll find that the more you push into your left hand and ground your right hip down, the more you'll feel that in the lower back. Play with that for a minute. All right, release, meet back in the center. And then bring your right hand out behind you again and push up. All right, giant stretch in the left side of your body. Feel this is our side opener. Feel the stretch all the way from your shoulder, literally down past your hips. Kind of like you're trying to make a giant C with your torso. Breathe into your left lung base. And then bend your left arm, put your hand behind your head, rotate your chest up towards the ceiling. A lot of work here. Squeeze your glute, lift up, 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 up. Lots of work. Open up that chest. And then bring your torso gradually down, down, down towards the ground with that hand bent. Feels amazing to stretch all that as you lower back down to the ground. All right, switch sides. Left leg bent, right leg out in front of you. Okay. Let's begin. Inhale, arms up. Exhale, twist to the left. Not a lot of twist, just looking to put your chest over your knee. Bring your left arm out behind you about a foot. Pull your right shoulder down and then tip your left ear towards your left shoulder. Hello. You should be feeling some stretches. If you're not, ground that right shoulder down more so that it's not sliding up like this. Really intentionally pull it down. And if you need to bend your arm so that your head dips lower, find what's right for your body. And then begin our seated cat-cow. So start to tuck your chin to your chest very slowly, slowly, slowly. Move your thoracic spine towards the wall behind you. And then slowly, slowly, slowly bring your chest forward, chin up towards the ceiling.
And then a couple cycles through at the speed of your own body. If there's a place you need to linger, please do. All right. Meet in the middle when you're done with the one you're on. And then bend forward over your right leg. Reach for the outside edge of your right leg with your left hand. Bend your knee if that's too much hamstring. Ground down through the left hip. Don't let it slide up like this. Keep it on the ground. Press into the palm with your right hand to help ground that left hip down. Back to center. Bring your left hand about a foot behind you and lift up. Feel a giant stretch on the right side of your body. Again, kind of making a C shape. Feeling a huge opening in the side body from the shoulder down past the hip. Breathe into that right lung base. Deep breaths in. Really feeling it. Bend your right hand at the elbow. Hold the back of your head. Shift your chest up towards the ceiling. Lift up with your glute. Lots of work here. Push, push, push. Open, open, open. This is effort for sure. And then release. Come back into that stretch and gradually fold, stretching the right side of your body the whole way back down towards the ground. All right. Straighten out your left leg, roll over onto your tummy with your left cheek on the mat. Palms beside your shoulders so that you can move yourself isometrically, which means you press down, but you don't really move them. You're not going like this with your hands, okay? So move your hands as if you were going to slide your left cheek across your mat towards the left. So you're pushing down with your hands and pushing to the right. Bring your elbows down by your side. You are looking for a stretch in your neck.
Breathe here. Unwind, come into a baby cobra. So gaze down at your mat, lift up. Option to pull your hands up off the mat if you want a little bit of strengthening. And then switch sides. Put your right cheek on the mat. Move your hands in a way that you are pushing down and then pushing to the left as if you were going to drag your right cheek across the mat. All right, there's a little surprise in my body here for me on this side. Whew, that really hurts. Do a very gentle stretch. Bring your elbows closer to your side if you need more intensity. Breathe here. Let the muscles in your neck relax as much as you can. This is a totally passive stretch. And unwind, baby cobra again. Keep your neck nice and long, not moving up like this, nice and long. Lift up, option to lift your hands up off the mat if you want a little bit more strengthening. And push back into tabletop. And then come through into a bridge. We've got two options for this bridge. I'm going to demonstrate both. And you should just choose the one that gives you the type of stretching that you need. So for the first one, you come into a typical bridge position, soles of your feet on the floor, knees bent. Lift your hips up towards the ceiling. But now what we do differently here is we're using this bridge almost as a way to massage the muscles in the back, okay? So bring your hands together, bring your fingertips up as close to the ceiling as you can get them to go, but roll off the side of your spine so that all of your weight is between your shoulder blade and your spine. So your weight's on those muscles, it's not on the bones. And then roll down. And then play with it on the other side. Lift up, weight off to the side, so it's really on those muscles. And then roll down. Now, if you need more pressure on those muscles in order to get them to release, here's what you do. Bring your feet up the wall. And it's kind of the same thing. Interlace your fingers together, bring your fingertips as close to the ceiling as you can. Roll up. I want you to be very careful not to be on your spine, but on the muscles off to the side. And wow, that will press out that muscle spasm. Yeah. Roll down. You are working on the rhomboids, which is the muscle in between your spine and your shoulder blade. And that bad boy likes to keep a lot of muscle knots. The trapezius is on top of it. And that is another big offender. All right. And then switch sides. Lift up to the left. So spend a few minutes here in whichever version suits your body right now. And really just use this as a way of massaging out, physically pressing that knotted muscle out flat.
you'll notice a tendency to let your fingertips drop away from the ceiling as you roll down. Resist that. Keep those fingertips pulling up. It will increase the pressure on those muscles and help you relax them. Forcibly relax them. That's kind of what we're doing. All right. All right. Now, whichever position you were in, next we are taking happy baby. So come onto your back with the soles of your feet up towards the ceiling. Grab the outside edge of your feet. Let your knees drop wide. Now, our strategy here is to do first one side of your back and then the other, because it can kind of hurt as you roll across your spine if you just go back and forth a lot. So we're going to sort of spend time on one side. So here's what this looks like. You are rolling across the back. And again, this is a way to massage the muscles along the spine. All right. So here with the feet about here, the pressure ends up being in the middle part of my back, like from here to here. Now, if you bring your feet down, the pressure goes to the lower back. So if you're having SI joint problems, this is a good place for you to be. And if your issues are higher up, you're going to want to bring your feet a little bit higher. You're sort of contracting your belly and roll higher up. You see what I'm saying? So play with this for a minute and figure out where your body needs it the most. What you're doing is, if you can imagine, your ribs are inside, right? You are pressing your ribs by bringing your legs out to the side like this. You're pressing your ribs into those muscles. And then what's on the outside of the muscles? The floor. So you've got floor, muscles, rib, and you're really massaging those muscles between your ribs and the floor. So spend a few minutes playing with that on the right side, and then we'll switch over to the other side. All right, switch sides. Rolling off to the left. And come back up into a seated position. Sit with your knees below the level of your hips. Put your hands on your knees. Now we will repeat our body scan
Just observing your body neutrally with the eye of a camera. Left foot, calf, knee, thigh, hip, pelvis, right hip, thigh, knee, calf, foot, base of the spine, middle spine, upper spine. Both shoulders, upper arms, elbows, forearms, hands. Back of the head, top of the head, forehead, eyes, nostrils, lips, tongue, jaw, neck. So I'll share my observations about what I'm noticing in my body. So when I did the first body scan, I was noticing a lot of holding in my right hip and in my shoulders. And it was like impossible to shut my eyes. And what I notice now is that this holding is less. My shoulders are pretty relaxed, actually, and it was much easier to close my eyes. And in the ancient tradition of Ayurveda, the whole purpose of yoga was to settle the body so that we could meditate. Now, one of the purposes of meditation is to be able to observe the mind in the same way that we just observed the body. It may sound strange at first, your mind observing your mind, but what it wakes you up to is the fact that you are more than your thoughts. The brain makes thoughts, that's its job. The heart beats, that's its job. And on a certain level, our thoughts are no more than that. They are the brain doing its job. We have a tendency to amplify our thoughts, to view them as the truth, to view them as our reality, to view them as who we are. But we are not our thoughts. We are much more than our thoughts. We are human. And so one of the purposes of meditation is to develop this capacity to sort of view our thoughts in perspective, to keep them in perspective, to recognize that thoughts are only one part of our being. So using your capacity to observe your body as a model, you can think about observing your thoughts. So let's spend just a few minutes doing exactly that. We'll close our eyes. And I'd like you just to observe your thoughts as being something outside yourself, something that comes and goes, which thoughts definitely do, right? In the same way that you have just observed your body with your body scan, and you have hopefully learned a little bit from the movements you did today about how different movements
affect your body, I'd like you to bring that same ability to observing your thoughts. So close your eyes. You'll notice that thoughts come up pretty quickly, but observe them with that same sense of detachment that you observe your body with. Just let them come and go. And settle into the part of yourself that is the observer of your thoughts. We'll take a few minutes here. And when those thoughts come through, as they inevitably do, and you feel yourself going down the rabbit hole, chasing those thoughts, chasing that train of thoughts, just pause and remember, you are watching your brain at work. Take another minute here. And then open your eyes, grab your journal. And then at the top of the page, I'd like you to write, is there a message for you? Either about your body or your mind, reflections on how these movements impacted your body, reflections on this whole concept of observing your mind in the same way that you can observe your body. We'll take just a few minutes here. All right. And if you have the luxury of reflecting further, please do. But if you need to get back into your day, please put one palm over your heart, put your other hand over the first one and press deep. Feel your heart beating. You are alive. Your heart is beating. You are here to live, to learn, and to love. Open your eyes and bring that feeling with you into your day. Thank you so much for being here today. Namaste.